Hi and welcome to Pebbles channel. So we were talking about safety and first aid. We all know that accidents occur mainly due to our carelessness. But at times, in spite of being careful or cautious, accidents do happen. In those cases, the immediate medical help that can be given to the injured person is called first aid. As told earlier, a first aid kit needs to be kept at home, at school, or in the working places or wherever possible. In case of any injury, we could use the items that are available in the first aid kit, like your bandage, cotton, antiseptic lotion. All these prove effective in the case of an accident. So, what are all the things where first aid comes in? Talking about first aid for burns, be it a minor, a severe, or a chemical burn, first aid can be rendered. And in case of severe burns or chemical burns, it is necessary to give first aid and take the person to the hospital immediately. First aid in case of burns is we need to put the burnt area under cold running water till the burning subsides and either apply a layer of dough if it is available in the refrigerator in case of minor burns, or apply an antiseptic lotion and keep the area covered. Talking about first aid in case of cuts and scratches, the cut or the scratch, the area where it occurs, needs to be washed thoroughly with water and then apply an antiseptic lotion and cover the wound with a sterile gauze in order to stop overbleeding. Talking about first aid for nose bleed, we need to make the person lie flat on his back. So these are some of the first aid that can be rendered to a person who is having nosebleed. Lie the person flat on his back, prick the bridge of his nose and place an ice cube on the bridge of the nose and pour cold water on the head, because nosebleed occurs mostly during the summer season and it is because of overeating of the body. First aid in case of fractures, the fractured hand or leg or part of the body that is fractured should not be allowed to hang loosely, but it needs to be given a support. In the case like a cardboard or anything flat, and use a string or a piece of cloth to tie it. And the support that is used is called the splint, and the cord or the thread that is used is called the sling. Next, moving on to sprains. Sprains leads to inflammation or swelling of the body that is sprained, and in that case you need to follow the riser method, that is rest. So the hand or leg or part of the body which is sprained needs to be kept at rest. Ice, we need to place an ice pack on the sprain to stop inflammation or swelling. Compression needs to be given elevation, that is, it needs to be kept above the hip. And referral, we need to refer the person to a doctor who may further ask for an ultrasound or X-ray or a CT scan. So the riser method is rest, ice, compression, elevation and referral. Moving on to the next is the animal bites. Animals like cats, dogs, rats, etc., their saliva carries a deadly disease called rabies, and the major symptom of rabies is hydrophobia. A person suffering from hydrophobia is afraid of water. And in the case of an animal bite, the area that is bitten needs to be washed thoroughly with soap and water in order to remove the saliva, and then an anti-rabies injection may be prescribed by the doctor. In case of snake bite, a cloth or a tight rope needs to be tied above the bite in order that the blood does not flow to the heart, and the person needs to be administered by a doctor. And next is preventing poisoning. Naphthalene balls, medicines, all these that are harmful to children needs to be kept far away, that is away from the reach of the child. Naphthalene balls that have expired, the expiry date has been given, needs to be thrown away. Medicines also which has crossed the expiry dates needs to be disposed in the garbage. And the last is fire safety. Fire safety. Fire mainly occurs because of carelessness while lighting a matchstick. So we should take care that, especially when children around, fire matchsticks should not be kept. So these are all the first aid that is rendered for burns, cuts and scratches, nosebleed, fractures. Then talking about your sprains, animal or snake bite, preventing poisoning, and how to be fire safety. Now we are going to see what precautions one should take. So precautions one should take to safeguard ourselves from fire. So what are the precautions we can take in order to safeguard ourselves from fire? The first most important point is don't play with matches and lighters. If you see matches or lighters where you can reach them, don't touch them. Especially families that have small kids around should be extra cautious when they place matches or lighters down. The next point is never wear nylon or synthetic clothes while in kitchen or while handling fire, because nylon or synthetic clothes catch fire easily. Always wear cotton clothes. So the next important point is never wear nylon or synthetic clothes while cooking or when you have engaged in some sort of firework, because nylon or synthetic tend to catch fire easily. Always wear cotton clothes. The next point is, in case of electrical fire, do not throw water to put out the fire, as it can cause electrocution. In case there are any wires that are getting burnt, so electrical fire, then it is always good not to throw water to put out the fire, as that may cause electrocution. Instead, use sand or mud. So these are the precautions that we need to take when we are dealing with fire in order to safeguard ourselves. So the first is, don't play with matches and lighters, or if you see matches or lighters where you can reach them, then don't touch them. The next point is, never wear nylon or synthetic clothes while in kitchen or while handling fire, because nylon or synthetic can catch fire easily. Always use cotton clothes. The next point is, in case of electrical fire, do not throw water to put out the fire, as it can cause electrocution. Instead, use sand, mud, etc.